appraisal is a structured and a thorough evaluation of a study's trustworthiness. And hence it assesses its rigor in terms of methodology and ethics and theoretical contributions to the field. It's very much a systematic process, and it ensures that a study is not judged in an arbitrary manner, but instead it's assessed in a systematic way based on clear and consistent criteria. And that process often requires the appraiser to bring practical wisdom together with their personal experience, as well as their experience in conducting and reading research together. Because personal history and biases, of course, inevitably shape how research is viewed in our eyes. Now, the heart of critical appraisal really lies in its methodological rigor. Researchers commonly discuss this in the results and the discussion section of their publications, but oftentimes we know that authors are not sufficiently rigorous. To achieve consistently, there's checklists that we will see, which are frequently used to evaluate the strengths and the weaknesses of studies in a methodological way. These checklists are tailored to both qualitative and quantitative research, which is something that we will see throughout this week's content, and assesses aspects like sample size justifications, appropriateness of data analysis techniques, the validity of the tools used, such as questionnaires, etc. And a well-known example in quantitative research, which you would have seen before when you were doing your science and pseudoscience assessment and you used systematic reviews or meta-analyses, is the Cochrane Risk of Bias 2 tool, or the ROB2 tool, which is commonly used to assess randomized controlled trials. However, despite the usefulness of these checklists, it's also important to note that many of those checklists really lack strong evidence to support their reliability across studies or across assessors, and usually a sufficient amount of training is needed before you can really use them. So in our case, while we are going to look at some of these tools, and you are perhaps going to use them and apply them to your final assessment, it is never going to be our intention that you are going to use them for the sake of publication. That's just way too difficult. So what we'll do is we'll remember a few key items from them so we can use that to critically appraise the literature that you'll be reading for the rest of your life. In systematic reviews, as you've seen before, critical appraisal is very common, and it usually goes further by assessing not only a study's internal rigor, but also its suitability and its relevance to the review's purpose or the topic at hand. This is done through two key concepts, either the design suitability and the study relevance. So in other words, can the study in its current form really say something meaningful about the research question? And is the study truly relevant to this topic at hand? For instance, a systematic review on the efficacy of a psychological intervention would prioritize experimental studies. Right? We're talking about the efficacy of an intervention. And design suitability would therefore hinge on whether or not a control group was used and whether or not there was appropriate randomization. Study relevance, on the other hand, is about how well the findings of the study or of the appraised study apply to the context in which they will be used. For example, when we create or try to create practical guidelines for athletes, critical appraisers would really focus on studies that involve competitive athletes if they want to make inferences about this particular aspect in competitive athletes. Just like we have the issue of representativeness in a single study, we also have the issue of study relevance or its representativeness in the larger scale of, for example, a systematic review. So ultimately, critical appraisal really enhances the quality and the applicability of research by really carefully assessing its strengths and its limitations, ensuring that whoever reads these studies truly understands the light in which the results and the interpretations of that study should be used.